A graduate student in Rhode Island is denied an internship because she takes medical marijuana to help to reveal pain.
In Rhode Island, medical marijuana is legal. She is suing the company. Fox 7's Casey Claiborne live in the studio with more on this. Casey.
Mike, as Fox 7 has reported many times, prescription pill abuse has become somewhat of an epidemic nationwide. Just a few weeks ago, we told you about a Leander bus driver arrested for DWI after police say she was popping pills with a busload of kids. So in light of this young woman losing her internship, we wanted to know what some of the differences are between medical marijuana and prescription pills. Vincent Lopez has Becker's muscular dystrophy. Lopez is 42 now. He was diagnosed at just 11 years old.
It brought on mobility issues, accessibility issues, care issues, everything like that.
Lopez says the medication his doctor prescribed him wasn't helping.
I was on codeine for a few years that I was prescribed, and that was causing, once its addictive properties started kicking in, it started suppressing my appetite and it started, keeping me from sleeping.
So he tried using cannabis instead.
Once I realized that the codeine was actually out of my system completely, it's when the therapeutic properties of cannabis really kicked in and really started having their effect on me. And of course I was eating better, I was sleeping better.
Lopez is now an advocate for medicinal marijuana with Texas Normal. We told Lopez about what happened in Rhode Island. A graduate student denied a 2-month internship at a textile company because she uses medical marijuana for migraine headaches. Marijuana is legal for medicinal purposes in Rhode Island.
I don't believe medical cannabis to be such an extent to impair somebody from working, compared to what prescription medications have done to people, to where people can't even perform in their own living room, They can't even function at their own dinner table or even with their own families.
The U.S. government doesn't fully support medicinal marijuana yet, saying many have called for the legalization of marijuana to treat conditions, including pain and nausea caused by HIV/AIDS, cancer, and other conditions. But clinical evidence has not shown that the therapeutic benefits of the marijuana plant outweigh its health risks. Local physician Dr. Neeraj Shah recently spoke at an event with Lopez. He says there are plenty of differences between cannabis and prescription medication.
We've never had a case in the ER or the hospital where cannabis caused somebody to stop breathing. Whereas we see that very commonly. I saw 2 cases just this week in the hospital where I had to give some medication to reverse the opiate.
Dr. Shaw says he's in favor of a narrow-scope medical marijuana program here in Texas. Representative Elliot Neistad has introduced a medical marijuana bill the last 6 sessions. It's not an all-out legalization, but it helps those with bona fide medical conditions.
You can go into court and you can say to the judge, Your Honor, look at me. I have multiple sclerosis. I'm not a criminal. My doctor suggested that I tried this. It's working. That the judge could, using his or her discretion, dismiss the charges.
For Lopez, he's not afraid to admit he uses medicinal marijuana.
The way I look at it is, what can any law do to me that this condition isn't doing to me already? And they want to talk about freedom. And I usually tell people, I fight for my freedom every day I wake. And it has nothing to do with the law.
Dr. Shaw also told us marijuana is a psychoactive drug, so when and if it's legalized for medicinal purposes in Texas, just like prescription pills, you shouldn't operate heavy machinery or get behind the wheel. Also, the bill we talked about with Representative Elliot Neistad, he says he will introduce that again this session.